We Pennsylvanians are in a fight for our lives. The enemy is a deadly virus set on destroying us. Over the past 2 months, this enemy has infected almost 60,000 of our fellow citizens. It has killed almost 4,000 of us. These are our loved ones, our friends, our neighbors. It has threatened to overwhelm our healthcare system, and it hasn't finished with us yet. Still, over this past weekend, some have decided to surrender to this enemy. These are politicians who were elected to serve their fellow citizens. Others are business owners who have chosen to serve their customers by putting them in harm's way. These folks are choosing to desert in the face of the enemy, in the middle of a war that we Pennsylvanians are winning and that we must win. Let me share a few facts with you. We are indeed showing signs of success in this fight. We have begun to flatten the curve of infection at many parts of the Commonwealth, which is why 24 counties have already moved into the yellow zone, and 13 more will move into the yellow zone on Friday. That's over half the counties in the Commonwealth. Meanwhile, we have bought valuable time. This means we have not overwhelmed our healthcare systems. This means we have done a better job providing our heroic frontline health workers with the materials they need to fight this deadly fight. This means we have given our economy the time to increase the supply of tests to improve our chances to one day beat this enemy. But the fight is not yet over, and this is not the time to give up. We have fought this deadly enemy in the best way we can. This war has called on every single Pennsylvanian to fight, and we have, heroically. It has been a new kind of heroism, in many ways a quiet heroism, but a heroism nonetheless. We Pennsylvanians have sacrificed in ways we could never have imagined. We've separated ourselves from our families. We've isolated ourselves in our homes. We have shuttered our businesses. We have closed our schools. These heroic acts deserve to be met not by surrendering, but by staying the course. And that's what I intend to do. To those politicians who decide to cave into this coronavirus, they need to understand the consequences of their cowardly act. The funding we have put aside to help with fighting this crisis will go to the folks who are doing their part. And that includes our CARES Act funding, which will be used to support counties that are following the orders to prevent the spread and the medical communities who are treating patients. However, other discretionary funding won't go to counties that put us all at risk by operating illegally. To the politicians urging businesses to risk their lives and to risk the lives of their customers or their employees by opening prematurely, they need to understand that they are engaging in behavior that is both selfish and unsafe. You business owners, these politicians put you at risk of losing your health department certificate. They put you business owners at risk of losing your liquor license. They put you business owners at risk of losing your certificate of occupancy. All of these depend upon your doing everything you can to keep your patrons safe. And by opening before the evidence suggests you should, you're taking undue risks with the safety of your customers. That's not only morally wrong, it's also really bad business. Businesses that do follow the whims of local politicians and ignore the law and the welfare of their customers will probably find themselves uninsured, because insurance does not cover things that happen to businesses breaking the law. And let me be clear, employees that fear for their safety because a business has opened illegally, well, they don't have to go to work. Instead, they can stay at home, stay safe, and collect their unemployment benefits. Finally, the politicians who are encouraging the people they were elected to lead to quit the fight are acting in a most cowardly way. This is not the time to give up. This is not the time to surrender. This is the time to rededicate ourselves to the task of beating this virus. The point is, we are fighting a war that has taken the lives of too many people. We are winning the war, but it has not been easy. It calls for sacrifice. It calls for heroism of a sort we have never asked of ourselves before. And it calls for all of us, every single one of us, to fight this war together. We all owe this to ourselves, and we owe it to each other. I intend to keep fighting, and I believe the overwhelming majority of my fellow Pennsylvanians intend to keep fighting too. And with that unity, I know we can win. Thank you. Yeah.
Well, we have a number of questions, Governor, of things that you've already really covered in your remarks today, from the AP, PA Post, PennWatch.org, WPVI, a number of other media outlets asking about your intention for the counties who have said they're going to defy your orders and reopen. So I'm going to go to maybe more specific question about why not let businesses open statewide and allow people to choose for themselves what's safe? Why can't adults make adult decisions for themselves and their families?
I think that makes perfect sense. What we've done with the regulations, the Department of actually Agriculture makes the health inspections for restaurants, the Liquor Control Board, the Labor and Industry Department for the safety of the building. That's why we have certifications, so that people can make decisions on their own, so that they can make reasoned decisions based on good information. If a business chooses to open, they're not making a good decision for their customers, and their customers need to know that, and that's what this is about. And when it comes to their employees, they may be forcing almost their employees to be in a situation where they're not healthy and they're not safe. That's what we're trying to do here. We're trying to beat this virus. The virus is setting the schedule. The virus is telling us what we need to do, setting the pace. And we all need to be on board to try to keep people safe.
From WGAL, district attorneys say they will not prosecute if businesses reopen while still in the red phase. What is your response to that?
Well, all prosecutors have prosecutorial discretion, but again, I'm not going to put up with any politician anywhere in Pennsylvania jeopardizing the lives of the citizens of those counties. They might be the citizens of counties where district attorneys are elected, but they're also constituents and citizens of Pennsylvania.
Another question from WGAL. Has the process been unfair to smaller businesses who may feel they're on the brink of closing while larger chains have been allowed to stay open?
This virus has been unfair to a lot of people, a lot of businesses, a lot of organizations, and that's why we have done everything we can at the state level, and I think the federal government is doing a lot too, to make sure that we help businesses, small businesses, and families and individuals make it through these tough and unprecedented times. So yes, this period of time is unfair to all of us. It's frustrating, but this is the dictate of a virus that we're all fighting. It's not the dictate of some abstract law or some politician trying to impose his or her will on the people of Pennsylvania. This is the virus speaking. We're all trying to make sure that we stay safe given the deadly virus that is surrounding us, and that's what I'm trying to do.
Another question on that subject from the York Daily Record. The York County District Attorney has also said that they will not prosecute businesses found in violation of your order, and the DA is instructing local police departments not to enforce the order. Would or could you deploy the state police to enforce your order?
Well, actually, the state police has enforced the order. They've issued a number of warnings, I think very few citations. But again, this comes down to the things that we can do to make sure that we're keeping people safe with certificates of occupancy, with health certificates. But it also comes down to the moral imperative that every Pennsylvanian has in trying to work together to fight this virus. We're all in this together. And if one of us deserts the cause, we're not only hurting ourselves, we're hurting everybody else in Pennsylvania. We have an imperative to stay in this fight, and stay the course.
We have a question from Fox 56. Democratic State Rep Marty Flynn is getting backlash over a Facebook post where he said he would stop supporting businesses who were speaking poorly about Democrats. What's your reaction to the state rep's actions?
I think Representative Flynn has actually apologized, but let me just say that I understand Representative Flynn's frustration. He has worked really hard, as so many representatives and senators have worked hard to keep their constituents safe, and he's done that, and I think he deserves real credit for that.
This question's from WTAJ. With the PA primary less than a month away and stay-at-home orders still in place, workers are concerned about their safety at the polls. Is there any talk about postponing the primary at this point?
I think there have been the random conversations about postponing it, but I don't intend to do that, and I don't think that there's anybody who's seriously doing that. What we are trying to do instead is encourage people to take advantage of voting by mail. And over 1 million Pennsylvanians have already signed up for that, so that instead of having to go to the poll and jeopardize your health, you can actually vote in the safety and security of your own home.
We have a question from Penn Live. Can you talk about the importance of testing and contact tracing for reopening a county and whether those systems are in place in Dauphin, Cumberland, Lancaster, and other central PA counties still in the red phase?
Yeah, I can't speak for each of the counties. I don't know what the capacity is in each county, but testing and contact tracing are very important parts of any county that goes into the yellow phase.
We have a question from the Butler Eagle. Understanding that many counties still need to move to yellow, is there an estimated timeline when counties may begin moving from yellow to green?
Not yet. We haven't decided. We still, as you know, as you just acknowledged, we still have counties that are moving from red to yellow, and we have more counties to come in the future. We have not yet set a timeline, even for those counties moving from red to yellow that are still in the red zone, let alone move from yellow to green.
This question's from WTAE. This morning, President Donald Trump tweeted that the people of Pennsylvania, quote, want their freedom, end quote, and also tweeted, quote, the Democrats are moving slowly all over the USA for political purposes, end quote. Do you have a response to the president's tweet this morning?
Yeah, I don't know how you stay safe and move quickly. We're trying to move deliberately. In Pennsylvania, I closed down the state. The Commonwealth closed down the state in a measured, staged manner, and we're reopening in the same measured, staged manner. I think that's aimed at keeping people as safe as we possibly can in these uncharted waters, and I think that's the responsible thing to do. The irresponsible thing to do, as I said earlier, is to just willy-nilly go off and pretend that we can wave a magic wand and go back into business and suspend the reality of this virus that's surrounding us.
This is from Fox 29 in Philadelphia. Dr. Levine said Friday that there were discussions going on between her office and leadership in Philadelphia and southeastern Pennsylvania counties about a tailored plan for moving into the yellow phase. Can you tell us what you know about that and what you're thinking or when this might happen?
Yeah, again, Secretary Levine, Dr. Levine is working with that, and she can answer that more directly because she was in the conversation. I was not. But again, we recognize that everybody wants to move as quickly as possible. What we're saying is we need to balance that with the need to do this safely as we possibly can, knowing what we know about the capacity of our healthcare system, knowing what we know about how the virus spreads. That's what we're trying to do in every situation, including the Southeast, every other part of the state. This is what we're trying to do, and we will continue to focus on doing this in a balanced, reasoned, measured way.
Another question from Penn Live. Readers are pointing out that despite remarks that masks must be worn in red zone counties, social media cards issued by the governor's office and the Department of Health website are saying that masks are encouraged, not mandatory. Which exactly is this, and what do you say to Pennsylvanians confused by the conflicting statements?
Yeah, I'm not a lawyer, so I don't know what the issue is here. If you want to stay safe, you ought to wear a mask. Pure and simple. That's again, you can take that as something that maybe has force of law, but the real force is that virus that's out there lurking, waiting for an opportunity to move from one person to another. To the extent that you want to keep that from happening, wear a mask.
This question's from LehighValleyLive.com. How likely is it that parts of northeast or southeast Pennsylvania will reopen before the end of the stay-at-home order on June 4th?
I can't answer that. We haven't set a timetable, and we have to keep looking at the data. Again, this is not something that we're all passively watching. This is data that is generated by people who actually do the right thing, stay at home, wear masks when they have to go out. And those are the kinds of things that will lead to sooner rather than later of a moving from red to yellow.
This question's from the Inquirer. Why was the stay-at-home order extended 2 days past the date of the primary election?
I think it was just that happened to be a month. There was no connection in my mind between the primary election date and the expiration of the order.
This question's from the caucus. Will you release the rationale for why some companies got waivers to open?
We're trying to be, we just put out some publicity on the waiver results, I think, on Friday. And if there's more that we can do, we will continue to look for ways to make that even more transparent.
This is from the AP. What did you hear from Vice President Pence today about the situation with coronavirus infections in the White House? Where is Vice President Pence located while he is conducting the conference with governors?
Good question. I was not on the call with the Vice President. I was here instead. Marcus Brown, Deputy Chief of Staff for Homeland Security, is the one who is on that call. And he'll let me know what was said. So at this point, I don't know.
This question is from Penn Live. Senator Doug Mastriano called for Secretary Dr. Rachel Levine's resignation this morning, holding her responsible for the waves of COVID-19 deaths in nursing homes in Pennsylvania. Do you have a reaction to that, and what's your assessment of Dr. Levine's performance on the nursing home issue?
I haven't seen the letter. My assessment of Dr. Levine is she's done a phenomenal job, and I think we've got to be careful about blaming the messenger for the message. Dr. Levine has done a phenomenal job of making sure that we do what we need to do in keeping Pennsylvanians safe. I think it's a tribute to her that Pennsylvania has actually done a better job than many of our surrounding states in terms of the infection rate and the death rate. And that we moved more quickly than our surrounding state neighbors in terms of moving into the mitigation period, and I think, are moving faster on moving out of it.
Another question from PA Post. Multiple counties have chosen to test their entire jail population. This still hasn't happened at the state level with correctional facilities. Why?
Actually, it has happened in correctional facilities where we have had an outbreak, like SCI Phoenix and SCI Huntington. We have done population testing. In all other prisons, we do testing based just as we do in the rest of the population, because there's a limit. We have a limit on how many tests that we can actually administer, that we test those who show symptoms. But again, we have done surveillance population testing in 2 prisons where there has been an outbreak.
This is from the Tribune Review. What exactly will the Commonwealth Civilian Coronavirus Corps look like, and how will it function? How can people join, and what is the timeline for it?
Yeah, the hope is this is something that we really get up and running in the next 3 to 4 months. We know that we're going to need thousands of people to do contact tracing, and that would be one thing. But there are a lot of other things that are going to be necessary as we move into the future, where infectious diseases are just a way of life. And a civilian coronavirus corps is going to be a way to provide employment, but also, and training, but also to give the Commonwealth the capacity to deal with these infectious diseases that are going to be an inevitable part of our future.
We have 2 questions from WTAE. 3 questions regarding Brighton Rehab in Beaver County. What is the role of the National Guard assigned to Brighton Rehab? Will the facility be evacuated? And will the management's handling of patients during the pandemic be investigated?
Yeah, the National Guard has been deployed there. Specifically what they're doing, I think you really need to ask that question to Secretary Levine. She's going to be, I think, here at 2 p.m. this afternoon, so why don't you hold that question for her. And if the answer she gives is not satisfactory, then our communications department will make sure that you get that answer.
Another question from WTAE. What advice do you have for child care centers that will begin reopening in the yellow phase?
Yeah, again, this question came up Friday, and we have published on our website frequently asked questions. The CDC has its guidelines on its website. Those 2 places should be checked. I do not remember every detail of all the things that are going to be asked of child care centers. We want them to open. We want them to do it right to keep the children and the teachers safe.
This is from WGAL. Legally, who has the authority to reopen? County commissioners and state lawmakers, as we know, are calling for their own reopening this Friday. Can you legally stop them?
Yeah. The constituents of county commissioners are also my constituents of the General Assembly and the governor and the Supreme and the judicial system of the Commonwealth of Pennsylvania. The courts have ruled, the Supreme Court of the United States, the Supreme Court of Pennsylvania, and this was just reaffirmed by Pennsylvania's Attorney General, that under the Constitution, the judiciary has ruled that I do indeed have the ability to do this.
This question from the Bucks County Courier-Times. We understand that you met with Bucks County officials via Skype on Saturday regarding the county's request to move into the yellow phase before June 4th. Is this something you're considering, though the Southwest region has not met the metric for yellow phase as a whole?
Well, first of all, I did not meet with them by Skype on Saturday. I think Dr. Levine did. And so, again, you might ask her the question of what transpired at that meeting, but I have no plans to have an arbitrary date for anybody to reopen. We'll reopen as we see the coronavirus is giving us the latitude to do that.
This question's from the Observer Reporter. There seems to be a lot of confusion out there as to which businesses are allowed to reopen. Can you clarify?
Again, if you look at you mean in the yellow zone, going from red to yellow. If again, as I said Friday, if you look at the website, the frequently asked questions, I think that will answer all the questions as to which businesses should be opening and what they ought to be doing as they reopen.
I don't think I asked you this yet, and I'm sorry if I'm repeating it, but we had another question from the caucus. Will the insurance department tell insurers that certain businesses are defying orders to remain closed, thereby jeopardizing coverage for some?
Yeah, I'm not sure that's going to be necessary. If a business is open in a red zone, that's pretty much a violation unless they have some waiver or some reason that they're an essential service. If insurance companies need to have guidance or some advice from the Pennsylvania Insurance Department, the PID stands ready to give that advice.
This is from LNP. Do you have any intention to sue county governments that don't comply with your order?
No.
From News Talk 104.1, can you clarify your earlier statements that your administration will withhold state funding and possible federal CARES Act funding if counties open in defiance of your orders? Again, there's certain CARES Act funding that goes to specific areas and counties, and that is designated by the federal government. And money that is intended from the CARES Act to go to healthcare facilities that are actually treating the patients, that's going to go. What I was talking about was any discretionary dollars that depends on the counties participating in this war that we're all fighting. We can't afford to have people desert, and so the reward for desertion cannot be that you're just like everybody else and get the discretionary funding. Discretionary funding will go to those places that are doing everything they ought to do to keep their citizens safe. Thank you. This is from the Inquirer. Some public officials argue that the economic impact is now worse than the health risks. How do you weigh the economic effects versus the safety benefit?
Yeah, that's a great question. I think Wharton has done a model that tries to look at that, but I think any of the models out there probably miss the mark. For example, we don't know what the psychological toll that isolation produces. What we do know is that this coronavirus has a very deadly potential for all of us. And all you have to do is look at countries that waited too long to close down, like Italy, like Spain, states that have waited too long to close down. We have a bigger population than New Jersey, but we have lower incidence and a lower death rate than New Jersey does. And I think because we acted quickly. So we have done things to address a disease that is far deadlier, I think, than anything else that could have done, could have hit us, could have affected us. And so I think we have done a good job. The economic toll is going to be heavy, and I think the things that Pennsylvania has done to help small businesses, to help individuals, the things that the federal government has done through the CARES Act to help individuals, businesses, and healthcare systems, things we've done at the state level for hospitals, all those things are intended to offset the negative effects, personal and economic, of this virus. But in the end, the ultimate goal is to defeat that virus. If we don't do that, nothing else we do matters.
This question's from WESA. When do you expect guidelines for libraries to be finalized and released?
I don't know. All right, but I'll get an answer for you. Lindsay will get you that answer.
And a question from WLNP. Have you asked Attorney General Josh Shapiro to step in areas where DAs say they will not prosecute for reopening businesses in regions where the stay-at-home order is still in place?
No, I have not. Nor do I intend to.
And I think we're going to give you one last question. A lot of our questions really focused on many of the things you covered in your remarks today. So this is from News Talk 104.1. Isn't it true that the U.S. Supreme Court ruled in your favor in regard to the injunction requested, but is still taking up the constitutionality of your orders raised in that case?
Again, I'm not a lawyer. I don't know. Lindsay, let's make sure you get a good legal answer on that.
Thank you, sir. That really is all the questions we have for today. The Department of Health will be doing its daily briefing today at 2 p.m., so hopefully everyone will join us then. And thank you again.
Thank you.